Now to British Health Secretary Matt Hancock addressing the media.
In the areas badly affected, in London, for instance, and in Kent, the direction is clear and in many cases quite stark. The doubling times are short. And we have learned that when it comes to being a matter of when, not if, we take action, it is better to act sooner. So from 1 minute past midnight on Boxing Day, Sussex, Oxfordshire, Suffolk, Norfolk and Cambridgeshire, those parts of Essex not yet in Tier 4, Waverley in Surrey and Hampshire, including Portsmouth and Southampton, but with the exception of the New Forest, will all be escalated to Tier 4. Bristol, Gloucestershire, Somerset, including the North Somerset Council area, Swindon, the Isle of Wight, the New Forest and Northamptonshire, as well as Cheshire and Warrington, will all be escalated to Tier 3. And I'm afraid that Cornwall and Herefordshire have seen sharply rising rates and need to be escalated to Tier 2. This is not news that anybody wants to deliver, and I am truly sorry for the disruption that it causes. But I think people know how important it is that we take decisions like this to keep people safe and to protect the NHS. The second piece of news I want to tell you about is some developments about another new strain of this virus. Of course, the fight against the virus is a global effort, and we're constantly vigilant and looking around the world. And as part of our surveillance, and thanks to the impressive genomic capability of the South Africans, we've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks. The Chief Scientific Advisor and the Chief Medical Officer and others met their South African counterparts over the last day, and we are incredibly grateful to the South African government for the rigour of their science and the openness and the transparency with which they have rightly acted, as we did when we discovered a new variant here. This new variant is highly concerning because it is yet more transmissible and it appears to have mutated further than the new variant that's been discovered in the UK. We've taken the following action. First, we are quarantining cases and close contacts of cases found here in the UK. Second, we're placing immediate restrictions on travel from South Africa. And finally, and most importantly, anyone in the UK who has been in South Africa in the past fortnight and anyone who is a close contact of someone who's been in South Africa in the last fortnight must quarantine immediately. By quarantine, I mean they must restrict all contact with any other person whatsoever. We'll be changing the law to give this legal effect imminently. Now, these measures are temporary while we investigate further this new strain, which is shortly to be analysed at Porton Down. And I want to thank everyone involved for the seriousness with which I know that they will take these new instructions. I'd like now to move on to some more positive developments. The third thing I wanted to talk about is an update on testing. As you know, we continue rapidly to expand the testing capability here in the UK. We're expanding community testing yet further in areas where the rate of infection is highest, so we can identify people, and especially identify the around 1 in 3 people who carry the virus without displaying any symptoms at all. 116 local areas have now signed up for this community testing, and we're in discussion with more. And these rapid turnaround tests are proving to be extremely effective at finding cases where we otherwise wouldn't. And I'm today publishing an assessment of the Liverpool community testing project, which shows how effective this can be. I'd urge anyone who has the opportunity to take part to protect their local area. And at the same time, we're boosting rapid testing in care homes with a further £149 million to support that effort. So all those who work in care homes in England will receive 2 rapid tests a week in addition to their weekly PCR tests. Finally, amid all of this difficulty, the great hope for 2021 is, of course, the vaccine. The vaccine is our route out of all this. And however tough this Christmas and this winter is going to be, we know that the transforming force of science is helping to find a way through. I'm delighted to be able to tell you that the Oxford AstraZeneca vaccine, developed here in the UK, has submitted its full data package to the MHRA for approval. This is the next step towards a decision on the deployment of the vaccine, which is already being manufactured, including here in the UK. We are, of course, continuing to deploy the Pfizer-BioNTech vaccine, which is being delivered now from over 500 sites all across the UK, and we're adding more all of the time and accelerating the rollout. I'm also delighted to be able to announce that we have begun vaccination in care homes. We know that people who live in care homes are amongst the most vulnerable to this disease, and I'm delighted that we're able to do this. Again, it's another enormous logistical challenge, and I'm very, very grateful to colleagues in the NHS and in the social care sector who've worked together so hard to make this happen. This afternoon, it gives me great joy to tell you that the Chelsea pensioners will be vaccinated, along with care home residents right across the country. I think we all need a bit of good news. And the reality is this vaccine programme is the way we're going to get through this. Because every time somebody's vaccinated, our country becomes a little bit safer, they become a little bit safer, and we get a little bit closer to the life that we all want to get back to. I sincerely hope that this is my last press conference before Christmas. And I want to just take a moment, firstly to thank you and everybody watching for all that you have done and the sacrifices that you've made. And I also want to thank my whole team, who've done so much, including those here, Susan and Jenny, but including the huge team in the NHS, in the department, and right across the board. As a country, we've been faced with these enormous challenges, and it's been very tough. But I especially want to thank those who helped this country to become the first in the world to roll out a clinically approved vaccine. I want to thank all those who've helped us build a bigger capacity in genomic testing than anywhere else in the world, and of course, the biggest overall testing capacity in Europe. I want to thank our scientists who've discovered the first proven treatment for coronavirus, and I want to thank everybody working in the NHS and in social care for the work that they've done this year, and also for the work that's going to carry on this winter. And especially to colleagues who are working over Christmas, which of course is so important in the NHS and in social care. Look, I know how hard 2020 has been for everybody, and after delivering some really difficult news, if I may, I want to end on a reflection of where we are as a country. This Christmas and the start of 2021 is going to be tough. The new variant makes everything much harder, because it spreads so much faster. But we mustn't give up now. We know that we can control this virus. We know we can get through this together. We're going to get through it by suppressing the virus until a vaccine can make us safe. And that's been our strategy, and that's what we must do. We're not going to give up now, especially after so much sacrifice. And I know that some of these decisions are tough, but I believe that everybody making the right decisions, and I believe that everybody will do what is needed to keep themselves and others safe, especially this Christmas. And I know from the bottom of my heart that there are brighter skies ahead. And I'm now going to hand over to Jenny to give us an update on the data, especially on the impact of this new variant. Jenny.
Thank you, Secretary of State. First slide, please. So I'm just going to talk through about half a dozen slides which highlight in graphical array the comments which Secretary of State has just outlined. And as usual, the darker colours on the maps indicate higher rates or higher rates of change. On this slide, we can see on the left-hand side that in the last 7 days, this is the last full week, case rates up to the 17th of December, they've continued to rise at a very rapid pace. This is particularly in London, the South East, the east of England, and in Wales. And you can see that with the dark colours there, which equate to more than 400 cases per 100,000 resident population. One of the most important things, though, is not just how many cases there are, but the rate of change. And if we look to the right-hand side, you can see that the darker pink and the purple is where those changes are really starting to move more rapidly. So as expected, it perhaps doesn't show up quite as well on the slide here, but as expected, again, particularly in London, the South East, east of England and Wales. But you can also see that the colour is starting to change through the bordering areas, particularly into Suffolk, Cambridgeshire and Norfolk, and then treading down to the southwest. Next slide, please. What we can see here is 3 lines which are representing those areas which are currently Tier 4 areas, so places like London, and that's the dark black line. And you can see that since September there has been a rise, and then in November when the restrictions came in and we had, if you like, the original COVID, you can see that starts to decline, but then fairly soon afterwards, and particularly at the start of this month, you can see an extraordinarily rapid rise in cases moving upwards. The dotted line, the purple dotted line, are those areas which are now moving into Tier 4. And you can see the same shape of curve here. What we're trying to do is identify where that rapid increase is coming, which is most likely due to the new variant. And you can see that it's a parallel line to the areas where we currently know have very high proportions of new variant in the cases detected. What's equally important, I think, is to look at the green dotted line, and these are areas in the rest of England. Obviously, a month previously, we've tended to see very dark colours at the north, northwest, northeast, and what you can see there is the rise during September, October, the November restrictions coming in, and quite a significant drop in that dotted green line. So against our old version of COVID, if you like, the restrictions had effect, and what we're dealing with now is almost two different patterns, one for the new variant and one for the old. Next slide, please. And here, this is clearer, I think, in this one. So these are cases identified, the proportion of cases which are positive for COVID-19 from November and then running in through to the middle of December. The dark purple line is cases which are new variant compatible, and the green line are the cases. So in some ways this is reflecting the green and purple lines on the original map. And what you can see again is that the original version of COVID is been brought down from November. You can see quite a sharp decline in cases and a levelling off, but a very rapid rise in the new variant cases, which are moving forward at pace. Next slide, please. And again, if we just look at the 3 most affected areas, you can see this very starkly. The green line, again, is other cases. You can see that they've dipped from November. The national restrictions at that time brought them down. There is some rise now, but the real sharp increase, which is what we're dealing with, is the new variant-compatible cases. And obviously these are the most affected areas. In other parts of England, we're starting now to see a mixed picture where the other cases, the original COVID cases, have come down, have flattened, but we're starting to see rises. And what we're looking out for is that very sharp incline in the rate of change. Next slide, please. And of course, unfortunately, this then translates through to...
the UK health officials briefing the media on the new coronavirus mutation, also talking about how travellers from South Africa will have to self-isolate, considering that the new strain is even more transmissible, and the UK is now dealing with those 2 mutations. Ramping up restrictions and increasing levels of testing, with the hospital admissions at an all-time high, 75% increase over the past few weeks. We're leaving it there for the moment, taking a very short break. That remains our continuing focus.